Pak Hal, Pak Menteri, can we start now?
Sure.
Okay. All right. So, good afternoon, good day, everyone. Thank you for attending this webinar. We are very grateful today to have His Excellency Minister Bambang Brodjonegoro. He is the Minister of Research and Technology and National Research and Innovation Agency of Republic of Indonesia, and of course a very good friend of Australian National University. And Pak Bambang will be talking about research on COVID-19 and technology development in Indonesia. And we are also very grateful to have Professor Hal Hill to chair the session and also make some comments and lead the discussion on this seminar. So I'll turn over to Hal now. Silakan Pak Hal.
Terima kasih Acho. Selamat sore dari Canberra, dari Australian National University. Saya Hal Hill. It's my great honor to moderate this session. First of all, I have the pleasure of introducing our distinguished and honorable guest, Professor Bambang Brodjonegoro. He is very well known to this audience, to everybody, but even though he's well known, I do want to say a little bit about him, since I've had the pleasure of knowing him for a while. Pak Bambang has had a very distinguished career. He's held 3 ministerial posts. His current one, Minister of Research and Technology. In addition, he's been the Minister for National Development Planning, that is the Bappenas, and before that he was a Minister of Finance. So he's had 3 significant ministerial portfolios in his career. Before that, he was, and also, of course, he was Vice Minister for Finance and Head of the Fiscal Policy Office. Before that, he also had a very distinguished academic career, culminating in being Dean of Fakultas Ekonomi dan Business, Universitas Indonesia, for several years, as I recall. And of course, that's a major position in Indonesian academic life. In addition, he's had other careers on the side, as it were, one including he was the Director General at the Islamic Development Bank, I think in charge of research and training. And also I should note that Bambang has had an academic career in addition. He's published widely, especially on aspects of regional development and regional finance. He holds a PhD from the University of Illinois and of course from the University of Indonesia. I guess I should also mention, if I may, Pak Bambang comes from what you might call an education family. That is, several other members of his family have also held very senior positions in education. So, Pak Bambang, we know you're very busy, and we greatly appreciate you giving us your time. And we're very honored to have you and to welcome you. We like welcoming you in person to ANU, and you visited us quite often, but the next best is to welcome you via the screen. So thank you very much, Pak Bambang, and let me now pass over to you, and then we'll come back for discussion and Q&A. Terima kasih banyak, Pak, dan silakan.
Yeah. Thank you very much, Hal. Assalamualaikum warahmatullahi wabarakatuh. Very good afternoon, everybody. And of course, I would like to thank the Indonesia project at ANU for inviting me for this webinar, especially, of course, Professor Hal Hill, whom I have known for quite a long time. And then, of course, my friends, and used to be also my colleagues, Pak Budi Reso Sudarmo, Pak Arianto Patunru, Pak Firmin Witular, and others. In this webinar, of course, I will not touch my academic background, both economics and urban planning. Instead, I will discuss exclusively on the issue of my current responsibility as Minister of Research and Technology, especially research and innovation related to COVID-19. So for better explanation, let me share the material for participants of this webinar. Let me start with my responsibility. Of course, as a BRIN, Badan Riset Inovasi Nasional, or National Research and Innovation Agency, NRIA, we are in charge of carrying out research, development, assessment, and application, as well as integrating invention and innovation. So as you can see, of course, we do the research, but we will not stop on the prototype or the report of the research. Instead, we have to go further into downstreaming of research output into innovation. And then as a ministry, we have to create a research ecosystem, a good research culture for researchers, and encouraging the creation of various innovation to Indonesian people. And it has to have a wide impact to the society. On the next page, let me brief you about the current condition of COVID-19. I think, of course, you can follow every day the progress. One thing that still, of course, concerns us here in Indonesia is the number of positive cases, especially the rate of the increase of positive cases daily. Currently, we have more than 1,000 new cases every day. And of course, it has created concern because at the same time, we know that after this kind of partial lockdown for more than 2 months to 3 months, of course, we have some concern about economic activities. We have the concern about potential increase of layoff, potential increase of unemployment, as well as poverty. But then we cannot just, leave the health issue behind, because now, for example, we have now 66,000 positive cases. Of course, we have, a bit good news about the number of patients recovered. It's now more than 30,000. And if you compare the number of fatalities, I think the ratio now is almost 10 times. And it has been increasing, and it has been, of course, a good news. But at the same time, positive cases keep increasing. First, maybe because of the number of testing that now becomes more intensive. Currently, we are doing the PCR testing more than 20,000 samples a day. So of course, it might increase the number of the ones that tested positive. And of course, once you have higher testing, then you have more intensive tracing. Once you do the tracing, then you might find out increasing number of positive cases as well. So that might be the reason, as well as some areas in Indonesia, especially East Java, Jakarta, South Sulawesi, and Central Java, still reports quite high cases of the new COVID-19. So again, this still concerns us. Sorry. Economically, on the next page, you can see our biggest concern, of course, about the unemployment. And as you know very well, in Indonesia projects, unemployment in Indonesia, of course, positively correlated with the number of poverty. And with the contraction of our economy or recession, with the economic growth, at least on the second quarter, expected to be on minus growth, then layoff is unavoidable. And what we have to do is to make sure that the number of unemployment will not jump significantly. So of course, we have to balance between ensuring the health issue by doing strict protocol of COVID-19, but at the same time, we have to start thinking how to make the economy work, especially for small and medium enterprise, because they are the ones that very much impacted. But of course, we have to also concern about some business, not the SME, that also has problem, at least with their liquidity, because the demand for their product is significantly decreasing. Next. as a Ministry of Research and Technology, National Research Innovation Agency, of course, our job is how we can deal with COVID-19 in a better way, meaning that we have to find, of course, the ultimate quote-unquote weapon for COVID-19, which is vaccine. But meanwhile, we have to find ways to make sure we can manage this spread of COVID-19. And what we have done so far, we do the prevention side, especially vaccine, and also supplement to increase our immune against COVID-19. And then, of course, we're trying to equip and we are trying to improve the quality of personal protective equipment. And then, of course, we conduct the research on medicine and therapy. Medicine, of course, we are doing so-called multi-center clinical trial by doing the clinical trial of some medicines that have been reported as a, as a proper medicine for COVID-19 from different parts of the world, like Avigan, chloroquine, and also Tamiflu, and Remdesivir, and I think the latest one, dexamethasone. And of course, we have to make sure if those medicine, are proper for Indonesian patients. And then we do so-called plasma convalescent. This is the serum from cured patient, the patient that cured from COVID-19. We took the plasma and we inject the plasma into the patients with, I think, critical condition of COVID-19. So far, it has worked well, although still in the stage of trial, but it will move into kind of mainstream therapy for COVID-19 patients. Aside from that, we also promote the stem cell. Stem cell deals with the improvement of our lung, because you know very well, our lung is very much infected or attacked by this COVID-19. And then we do screening and diagnosis by producing and creating the first rapid test made in Indonesia. So we have, of course, many imported rapid tests, but now we have been able to make our own rapid test, plus our RT-PCR test kit now is also made and innovated by Indonesia, plus mobile lab, biosafety lab too. This is for specimen tests or PCR tests of COVID-19. And then for medical equipment, we have been able to create and produce ventilators. That's very much needed because, again, COVID-19 attacks our lung, our respiratory system. So ventilator is very much needed, and we are short by significantly in terms of ventilators in the hospitals. And the way we are working to produce those kind of things needed for COVID-19 is by applying what we call triple helix. I think triple helix, of course, is very, very well-known definition that has been applied in many developed countries, especially developed country that has strong innovation, like Switzerland, like Sweden, as well as Korea, South Korea. And Indonesia, of course, we have a dream to make triple helix works smoothly. However, prior to COVID-19, it didn't work smoothly because there is a lack, for example, lack of communication between the academia side or researcher side and the industrial or private sector side. Usually they cannot communicate well. So as a result, researchers come up with their invention. Unfortunately, their invention is not the one that accepted by the market because the industry tells them this is not the one that we want, that they want. So it means that there is a gap between research side and the production side. And of course, government has to be in the middle, not only to support the financing for the research, but more importantly, to facilitate this communication. And then during this pandemic, fortunately, this triple helix works quite smoothly. We are in charge of coordinating this synergy by including the academia, several universities, plus research institute like LIPI, like PPPT, and then we also include, of course, private sector, including state-owned enterprise, because they will be in charge for mass production of our innovation. And then government ministries has to be there. Why? Because we are not only facilitating in terms of financing, we are also facilitating in terms of communication, and we give them direction about what kind of invention, what kind of innovation that we expect from the research side that will also agreeable by the industrial side. And then let me share some details of our finding from our research and innovation so far. I know most of you maybe, not having the background in medicine, biology, chemical, and others. I myself also do not have that background, but I think this knowledge is very important to us in order to understand about the COVID-19 and how it can spread easily from one person to the others. First, let me share the result from Eijkman Institute that has done so-called WGS, which is whole genome sequencing. Whole genome sequencing is very important to characterize the type of virus that transmitted in Indonesia. And so far, Eijkman already submitted 10 sequences, and Erlangga University already submitted 6 sequences to GIS-AID. GIS-AID is kind of influenza bank, data bank, for influenza virus data bank that has collected genome sequencing from all countries in the world. So this picture shows that all Indonesian viruses are included in the clade. Most include clade 19A, which shows its ancestor, meaning the origin of the virus that transmitted in Indonesia. Most of them, from the 16, meaning 15 of them, the ancestor identified in 2019, meaning the virus coming from China, from Wuhan especially. And then, quite interestingly, one sequence that submitted by Erlangga, and Erlangga did the specimen test mostly in East Java. Of course, Surabaya is one of them. And one of the virus submitted entering clade 20A, meaning the ancestor identified in 2020. Or in other words, the ancestor or the origin coming from Europe instead of coming from Asia or from China. And so far in GIS-AID, they already have more than 60,000 whole genome sequencing. Maybe some of you will question why this data is very important. This is very important once you have the responsibility to develop the vaccine. Because the vaccine, of course, has to be effective in protecting against the virus that transmitted in certain area. Hopefully in all the world, all the countries in the world. But sometimes there are vaccines that only effective in some parts of the world. That's why identifying the type of virus transmitted in the area is very much important. And GIS-AID already made the groups SL, VG, GR, GH, and O. O means others, meaning still not classified. Initially, the ones that we submitted categorized in others, meaning they are not part of the original only 3, S, G, and V. And the ones that submitted from Indonesia, not included in either one of them. So they are categorized as others. And then, this is, I think, also interesting from you. We are showing you the journey of virus to Indonesia, in which the map shows that virus isolated in Indonesia all originated from Wuhan. but some of them so-called traveling through other countries. China to Germany, to Saudi, to Indonesia, China, Taiwan, China, Japan, at the end to Indonesia, through Singapore, even through Australia. So there are some, Indonesian or foreigners coming from China, they are traveling to Australia, and then when they go to Indonesia, they spread also the COVID-19 virus to Indonesia. And the rest, or most of them, directly from China to Indonesia. And of course, this will affect the mutation pattern of each virus. And then, if we look at the grouping in the GIS-AID, of the 15 whole genome sequencing submitted, as I mentioned before, most Indonesian viruses included in L, one in S, and one in O, meaning one is still not categorized because it's still part of others. One in S, meaning from Europe actually, and the other from L. L basically originated from Wuhan. Okay, so as a conclusion, distribution of viruses in Indonesia is different from the distribution of clades in Europe, America, and Africa, but there are similarities with China. So that's why when we are now working with vaccine development, we do double track. One, we do our own, meaning we are trying to develop our own vaccine using the method called protein recombinant. And the others, we are trying to use collaboration. With whom? With pharmaceutical company in China, because they already developed the vaccine. Now they are doing clinical trial, second and third stage. And why China? Because as you can see, the virus transmitted in Indonesia more closely to the ones in China than other parts of the world. So this is a story about the virus and how we will develop vaccine to deal with this virus transmission. And then some other products from our consortium, aside from hopefully vaccine in the near future, we already produce, as I mentioned, PCR test kit, rapid test, and it is important because rapid test is good for screening, while PCR test kit is good for diagnosis. Which one is negative, which one is positive. And then we also try to produce the supplement called immunomodulator. This is not medicine, this is more supplement, but supplement that's trying to be identified as the one that creates the immune for COVID-19. So specific for immune against COVID-19. And then we produce some robots, ventilator, as I mentioned, because we need that, the mobile lab, so we can deploy this mobile lab into different parts of Indonesia that has a limited number of lab that can apply the specimen test. And then don't forget the convalescent serum on convalescent plasma that now becoming one of the mainstream as a therapy for COVID-19 patients. And then if we move to page 15, this is just one, sorry, I think this, page, I think this one, yeah. Next one. Okay, this is just, I'm just trying to tell you that we also include so-called Industrial Revolution 4.0 in our innovation related to COVID. And one of the example is the robot. Why robot is important? They can be the substitute of nurses and other medical staff, because otherwise they have to be exposed quite frequently to the patients of COVID-19 that of course can, they are exposed to the virus itself, but instead with the robot, then they can reduce the number of face-to-face meeting with this patient of COVID-19. And then next, now we are working on improving the rapid test because there are complaints that rapid test, of course, doesn't show the result accurately. So we are trying to improve the accuracy of rapid test by doing new approach, including rapid test based on nanoparticle fluorescence in lateral flow immunoassay. And hopefully this can be, of course, operational in 1 or 2 months. And then to make sure our room is free of virus, we are producing, of course, autonomous disinfectant robot using ultraviolet light. And then immunomodulator, or in Indonesia is called herbal, yeah, but this is not just jamu atau obat herbal terdaftar. This is more on phytopharmaca, so medicine based on herbs. And we are now doing the clinical trial for some candidates for immunomodulator against COVID-19, like red ginger and Andrographis paniculata, and then Maniran sembung, yeah, cordyceps, yeah. Those are some of the herbs that we are trying to develop. I have discussed about vaccine, and then let me jump to page 20. Next, yeah, this one. So, sorry, this one. Yeah, on the left, that's rapid test. On the right is PCR test kit. Now it has been used quite widely in Indonesia. Of course, rapid test is for screening, like when you are trying to, let's say you board the plane, you know, let's say between Jakarta and Surabaya, then before you board the plane, you need to take the rapid test to make sure that you are okay. You know, you are not the one that potentially infects other people. And then for the right one, PCR test kit, this is used mostly for PCR tests to support the sample that will be treated as a diagnosis. And then let me show you the sample of mobile lab. So the lab basically in that container, and this container you have all the equipment to do the specimen test or PCR test. Of course, it has been equipped with all the safety related to the biosafety lab level 2. Yeah, and then of course the epicentrum can move from one area to the others. And of course, it's very costly if you have to wait to build new laboratory with all the equipment. Costly and of course takes time. And the solution is this mobile. Once you are done in an area, let's say the area is no longer a red zone, becoming a yellow zone, for example, then the lab can be moved to the other areas that's still considered as the red zone. And then for therapy, next page. Yeah, this is the convalescence. You can see the plasma over there, the yellow one. That's from the patients who have been cured from the COVID-19, and then it will be injected into the patients that's still in critical condition because of COVID-19. And so far, it has been produced by our state-owned enterprise with the cooperation with universities. And also in UI, we are trying to develop the stem cell to improve the lung condition that has been affected by the COVID-19. And then for ventilators, we already have 5 ventilators that already has permit, you know, to be distributed to hospitals or to other medical facilities. One innovated by UI, the other one innovated by ITB, Bandung Institute of Technology, and then one innovated by LIPI, and 2 others innovated by BPPT with the cooperation with the private sector or with the industries. So at least we have 5 different ventilators. They have also different functions. Some of them can be used for ambulance, some of them can be used for regular hospital room, but the others can also be used for emergency, as well as we are now developing for the ICU, for the intensive care unit. Let me jump to the new normal on page, this one. So in new normal, of course, we are now concerned with the second wave. I believe in Australia, I heard in Melbourne, now they are even kind of guarding tightly some areas, not only in the cities, but also in the border between Victoria and New South Wales. And of course, that's the reason why we need to really promote the less contact society or less contact economy. By what? By technology. So technology has to be the solution. So we can be productive, but at the same time, we can be away from the threat of COVID-19 itself, or we can also implement strict protocol of COVID-19. How can we do that with the technology? On next page, this one. So online shopping has to be more and more mainstreaming. I believe in Australia, everybody now, I think, comfortable just do the online shopping. Online entertainment, I still in the development. Yeah, still people think that the real entertainment, if you come to the movie theater, if you come to the concert, then you need to have technology in order to substitute this entertainment, and you can enjoy entertainment without fear of affected by COVID-19. Digital payments or fintech, of course, it has been our daily life, our lifestyle. You know, you don't have to go to the bank office. You don't have to meet the bank officer in order to do your transaction. Supply chain 4.0, which is very important. I think for Professor Hal Hill, you know very well, the life of manufacturing in the future will depend on the use of the technology or industry 4.0. And then teleworking, like what we are doing now, you know, I mean, of course, I don't have the luxury and, of course, enjoyment to go to Canberra, but at least we can still do our daily activities with the same level of productivity using the teleworking. 3D printing is already part of our manufacturing. Telemedicine now becoming more and more mainstream. So anybody who feels that, you know, they need to consult a doctor, they don't really have to come to see the doctor themselves, or they don't have to go to the hospital. Instead, they can do the telemedicine, and there will be more and more software application as well as equipment that will support the telemedicine. Robot and drone, for example, the ones that develop for being kind of substitute of the nurse, and then teleeducation. I believe the universities, including ANU, has to do this teleeducation, and I think we have to have in our mind, this is not an emergency situation. This is the beginning of the future, because the future, of course, we will implement more and more or Industrial Revolution 4.0. Digitalization will be there. And of course, the 5G technology and ICT will become our new routine. I think that will be my short presentation. And of course, I will be happy to come with the Q&A. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih banyak, Pak Bambang. That's such a comprehensive and informative and stimulating presentation. I know I speak for the audience in saying that we learned a lot from it. Let me just make a couple of very brief observations, then we'll open it up. I think I like the way you started and the sequence of the discussion. That is, you started with the economic dimensions and the huge challenge in the labour market and so on. And of course, that reminded us that this is a most unusual crisis. We have ever had nothing like it before, except maybe the Spanish flu over a century ago. And so traditional economic responses like just doing fiscal stimulus alone isn't going to be enough. So that was the first sort of takeaway, which I think is the really important one. I like the way you use the framework of this so-called triple helix, because it has to be like that, as you argued persuasively. It's got to be academia, industry, and government. And I guess my takeaway from that, Bambang, was actually a slightly hopeful one. That is, although the challenge is immense, there are a lot of activity and some hopeful signs. So I guess I took that as being a a rather hopeful sign. I hadn't seen the virus map before. That virus map is really informative. It's kind of scary, but it's informative, and it's reminding us of the challenge of a different form of globalization, and we have to think about how we're going to handle it. You mentioned also, Bambang, the international collaboration, in particular with China, since China, in a sense, like it or not, is the most knowledgeable country in handling this, and it's great to hear about that collaboration. I wonder whether there are other forms of collaboration which you have found helpful or which you would like to have. Would you like the international community to step up more, and if so, in what way? Then I like the technology roadmap, in a sense, the 10 trends. I think this is one of the most profound effects of this pandemic. And in a way, there's a slight silver lining, isn't there? In the sense that although we have this terrible problem, it's going to change the way we live and work and travel and health and education. So in a way, we are going to learn from it, even though it's a very hard way to learn. A couple of things just to raise, to put on the table. One is, how to fund all this. So all governments are now struggling because all governments, as you know, as a former finance minister, all governments are now having to run quite large fiscal deficits. Question is how they fund it and how they allocate funds across a lot of competing priorities, not just health, but all the other dimensions, including sustaining the real economy, the SMEs, as you mentioned. There's one question just to put on the table, just the funding of it. And again, would international support be useful there as well, I guess? Another question which comes up quite often, if I look at the comparative international numbers of COVID cases, Indonesia on a per capita basis actually looks very low. And that, I guess, is a very encouraging sign. And I'm sort of wondering why. Is it perhaps partly a more youthful population? There's this conjecture that younger populations handle things better, or is it that the shutdown has been working fairly well, or is it partly perhaps because, as you mentioned, Bambang, the testing and tracing regime is sort of expanding now, and that is probably picking up more of the cases. So there are a lot of other questions I'd like to put on the table, but I think now it's really time for us to open up the discussion, if that's okay with you, Bambang.
Sure.
We have about 90 participants. So ideally, we would actually invite people to speak directly to you. I'm just not sure whether we can do that because it's of the number, but let's try. So let's get some indication from the participants of interest in raising questions with Bambang. While we're doing that, Bambang, would you like to just comment a little bit on some of since some of us are economists, just how this is going to be funded? I mean, I guess traditionally Indonesia's R&D expenditure has been, 0.1%, 0.2% of GDP, and I guess the state budget now, as Minister Sri Mulyani would be reminding us, is under a lot of stress. Would you like to tell us a little bit about how you see some of the funding arrangements for these new initiatives?
Okay. Thank you, Hal, for some question. I think regarding funding, of course, the first stage of the so-called economic stimulus program funded by national budget, I think first is intended for the business stimulus itself, so in terms of tax incentive and other things. The second one, I believe, is for social assistance, direct support to the poor families or the ones that heavily affected by COVID-19, or in Bahasa, of course, it's called bansos. Yeah. And the third is for health management related to COVID-19. Yeah. And then for our research activities, of course, our budget in ministry has to be cut by 30%, around March or April, by 30%. From initially 2.7 trillion become only 1.8 trillion rupiah. And then, of course, we have this initiative of consortium. Actually, this is our own initiative, this design and of course initiated by our ministry with research institution as well as universities. And then finally, I realized that we have the endowment fund for research. Mm-hmm. So the proceeds of this endowment fund now becomes the source of the funding for research related to COVID-19. Yeah. And so far, we have been able to fund, I think, quite a lot of research activities related to COVID-19. And to my surprise, and this is not surprising actually, the budget for the research actually is not that high, because we are talking about research that has to be carried out in very short period of time, 3 to probably 6 months. So during that time, of course, you don't have to do the research from the basic research, development, and so on and so forth. You don't have to start everything from the scratch, or you don't have to start everything from the upstream. Instead, you can start with the strategy called reverse engineering or technology transfer. I think Pak Budi Reso Sudarmo knows very well because he was a former BPPT. So that's the fastest way to create production like ventilators, like rapid tests, even medicine. So for example, when we are now doing the clinical trial for supplement for the COVID-19, we are not doing from the scratch. We use the supplement that already in the market, and we test which one is does really have the strength or the capability to deal with COVID-19. Yeah. Which one can raise our immune against COVID-19. So this is our strategy, and our coverage is only up to prototype. Once it becomes the production, of course, it will be the responsibility of the industry or private sector or state-owned enterprise. And don't forget, at the end, there will be Ministry of Health that will do the procurement of ventilator, PCR test kit, rapid test. So the bulk of the budget actually more on users rather than the research side. That's why with limited amount of money, we can still innovate a lot of production.
Thank you. Thanks, Pak Bambang. So the questions are coming in now. So some of them, Pak Bambang, I might just read off the screen, and some may talk directly. The first 2 questions come from people who you both know well. One is Dr. Yogi Vidyatama from the University of Canberra. I think he was your RA back at
Yeah.
So let me go with Yogi, and then I'm going to invite Professor Terry Hull from the ANU to also perhaps ask a question directly. So Pak Bambang, Yogi's question, hi Yogi, if you're listening. Yogi's question is thanks you for the presentation. Yogi asks, is the ministry and the agency, that is the NRIA, also dealing with the information and misinformation about the latest progress in technology and innovation related to COVID-19? If not, who has the authority on overseeing the various innovation or claimed innovation on the issue? If yes, what's the strategy of the agency and the ministry to avoid society taking untested innovation? So maybe actually I was going to ask Terry also, but maybe I'll let you perhaps answer that one, Pak Bambang, because it's quite a long question. And then I'm going to go to Terry Hull, and then I'm going to go to another good friend of yours, Chris Manning in Yogyakarta. So it's the usual suspects, but can I first go to Yogi's question?
Let me answer Yogi's question. Yes, of course, when we are talking about innovation, our ministry or our agency is the authority for declaring whether this is already an innovation or not. Of course, first we have to identify whether this is innovation or just kind of cloning or just kind of copying, assembling, things like that. We have to differentiate between these two, okay? So this is our responsibility. And the other one, of course, we have to make sure whether the innovation already meets the criteria. The criteria here depends on, of course, the type of the innovation itself. When we are talking about COVID-19, most of the products, most of the innovation will have to pass the strict and, of course, rigorous tests from two institutions. If it deals with the equipment, it will be Ministry of Health. Ventilator, test kit, it will be under Ministry of Health. We have to pass all the tests by the ministry. Second one will be our FDA, Food and Drug Administration, or BPOM in Bahasa. So FDA will deal with the medicine, will deal with vaccine later, or supplement and others. And of course, if it is untested, it depends, you know. I mean, most of the time, if I observe the media, the claim sometimes is not on the right place because they claim they already deal with the COVID-19, while according to the procedures, they haven't done, for example, clinical trial. So that's our responsibility to tell the innovator, to tell the initiator, look, why don't you claim proportionally, and then why don't you join us in doing the clinical trial? Because we already have the procedure for clinical trial, for medicine, for therapy, as well as for supplement. So I think that will be the picture of how we trying to manage the innovation. I know there are many people that are trying to come up with their innovation during this time, which is good. I really appreciate. But at the same time, we have to make sure everything follows all the procedures.
Yes, I think that's terribly important, Pak Bambang. One only has to think of the case of the United States and all the fake news circulating and how confusion causes. So next, I'm going to now invite Professor Terry Hull to speak. If we can unmute Terry.
I
Terry,
should be unmuted.
Oh, hi, Terry. Yes, so silakan, Pak.
Thank you very much, and thank you, Pak Bambang. I was fascinated to see all those innovations that you were reviewing, but going back to one of the early slides about the numbers in terms of testing and counting the numbers of deaths, counting the numbers of cases, I'm just wondering about the process for validating the data, particularly as we know, right now, the BPS is in the middle of trying to save the census because the census was interrupted by this, this whole procedure. And we know that the Ministry of Health has long struggled to improve the death reporting data through the ministry's activities and also through local government. And I'm just wondering how this is going as an effort by the government to improve the data. Hal was mentioning the very bad example of the United States. And we know that there's a lot of other countries that are really struggling on this. And it sounds like Indonesia might have some advice for others.
Yeah, I think for data, it will be under the responsibility of both Ministry of Health and National Task Force for COVID-19, headed by the National National Disaster Emergency Agency. And then, according to the analysis, data analysis, of course, number one, yes, BPS is interrupted when they are doing the population census, although they are now introducing more online data. So, they don't have to send their officials to go, house by house, but instead they do it online. So it helps for improving the quality of the census. On the issue of the data, especially about the number of infected and especially the number of fatalities, I think the definition that used by Ministry of Health, especially because they are the one that in charge with the data, they use for the number of deaths, they use the ones that has the fatalities because of positive tests of COVID-19. And most of the fatalities coming from people who have other, serious disease, or the people who is in the category of, elder group. I mean, more than 60 years old. So in these two groups, the fatalities rate is quite high. And once, for example, someone has heart problem, or let's say have high blood pressure problem, and they pass away, and they have the positive COVID-19, then they will be declared as the ones that pass away because of COVID-19. But if someone with the high blood pressure but negative COVID-19 in their PCR test, then they will not be declared as the ones with COVID-19. It has been some debate because sometimes the PCR test, the result of PCR test, the real one, for example, the positive one, comes late, even sometimes after the people die. So that creates sometimes confusion and discussion whether we should include this as part of the COVID-19 or not. But in general, I would like to say, also responding to Hal's first question, I believe in Asia, in East Asia especially, the number of fatalities on average, not only Indonesia, but even in China, relatively low, and also number of infected relatively low compared to other parts of the world, especially Western Europe and North America. Not only North America, but also now South America. So there must be something related to the Asian people, maybe the type of virus that I mentioned before, because the virus that transmitted in Indonesia is very close to the virus that coming from Wuhan, and it's different with the virus that transmitted in Europe and in America. And of course, data validation at the end in Indonesia is the responsibility of Ministry of Health. And of course, the National Task Force also has their own team, but at the end, the data has to be consolidated under one roof, which is under Ministry of Health. So I think that's I think the explanation that I can tell you. I mean, given of course my limited authority in the detailed data of COVID-19.
Thank you.
Yes, thanks, Bambang. I think that's a very important point you make about East Asia in general, that East Asia so far looks, compared to all other regions, the most hopeful in managing the COVID, and therefore by extension will probably come out of the COVID in better shape and quicker maybe. So that's a very
hopefully.
Yeah. So next, Bambang, I'd like to go to our good friend Chris Manning in Jogja. Chris, are you able to speak, or otherwise I can read your question off the screen?
I think I can speak, Hal.
Yes, we can hear you, silakan.
Okay, thank you very much, Bambang. Very interesting and informative talk.
Okay, yeah.
I learned a great deal from a very low knowledge base. But Bambang, you touched on the testing rates in Indonesia, and my understanding is that is really one of the biggest constraints that Indonesia faces in getting on top of the virus. And I had a specific question with regard to that, and that is that, as I understand it, and I've seen reports of the matter, that the shortage of lab analysts is a major constraint to increasing the PCR testing. So I had a question, my question in two parts. What solution, is that true, and what solution has the government got to overcoming that problem? And second, maybe, could cooperation across ASEAN or other groups of countries getting lab experts in to assist Indonesia could that make a difference? So that's my question, Pat.
Okay, yeah. Okay, thank you, Chris, for the question. Regarding the testing, of course, we focusing on PCR tests. Let me brief you a little bit about like the history of the PCR test in Indonesia since the first cases in early March. So at the beginning, the responsibility only handled by one institution, which is the R&D Department of Ministry of Health, or Litbangkes. They are only the one at that time doing the PCR test. Nobody else cannot do it. Even the Ekman Institute, which is under my ministry, at that time they are not allowed to do the PCR test. However, once the number of infected becomes bigger, then we realize that we need more PCR tests, meaning one is lab under Ministry of Health will not be enough. And then Ekman Institute start to be involved, other labs needs also to be involved. However, there are some kind of constraint in trying to catch up with the number of potential infected people. Number one, PCR test needs laboratory with the qualification of BSL-2. And building BSL-2, I mean, of course, many hospitals, many universities have BSL-2. However, they are not well equipped with the machine RT-PCR because number one is BSL-2, number two, you need the RT-PCR machine. And the machine itself, of course, is quite expensive. And at the beginning, there are different types of RT-PCR machines that needs different, it's called reagent. Reagent is kind of a substance to be used for sample testing. So different machines sometimes requires different reagent. And then number three, we need the reagent itself. Unfortunately, 100% have to be imported, similar with the machine. So you can imagine at the beginning, the government needs to buy a lot of RT-PCR machines, as well as need to import reagent continuously from different parts of the world. Because sometimes if we depend on one, we cannot do anything. Then we have to go to other countries to supply the reagent. And then number four, the human resources. I think it will try to answer your question. Of course, there are many experts in biology, chemical, medicine, all related fields to the lab for doing the specimen test. However, working in BSL-2 requires specific qualification. And at that time, we are very much shortage of the lab personnel. So one institution under my responsibility, LIPI, doing their own version of the training for lab personnel. So as a result, we can increase more than 600 new lab personnel that can be deployed to different labs in Indonesia. And now with already 20,000 more labs, 20,000 more specimens tested every day from, I think now we have more than 100 labs for sure. And there is still the shortage of these human resources. So now with cooperation with the Ministry of Health, our ministry and Ministry of Health do the kind of massive training, especially for students in biology, students in chemical, of course not student in economics, to work in this BSL-2 lab, you know, and then hopefully they can be deployed everywhere in Indonesia. But one more thing, Pak Chris, this is again my experience dealing with the specimen test. In lab, there are two processes actually. Once they swab your saliva, then they will bring your saliva into the lab, and they will do so-called RNA extraction first before they go to the PCR machine. And after the PCR machine, which can be done perfectly by any trained lab personnel. They have to do the analysis. And you're right. The problem now with the analysis, if the result is quite clear, which is negative or positive, you don't need analysts. You can just go out with the result. This person this person negative, this person positive. However, there are some cases in which the result is in the border or inconclusive. So if it is inconclusive, then the specimen needs to be sent to the analyst. And the analyst usually either in hospital or in universities. And it will take several days to make sure whether this is really on the border or this is going to the negative or this is going to the positive. So I think this is the area in which the PCR test lab sometimes delay. I mean, the result is delayed even until 1 week, not because of, sometimes because of the bureaucracy for sure, but some others because of this border result or inconclusive result that needs further analysis. And in some areas in Indonesia, maybe the lack of analysts makes the delay even longer. I think that would be my response.
Thanks, Pak Bambang. I was just going to observe that this must have been a very steep learning curve for you and your staff over the past 6 months to get on top of this pretty complex, epidemiology and biology and science. So I think we're very impressed with how quickly you've got on top of it. But so we've now been going for a little bit over 1 hour. Pak Bambang, we have an allocated time of 90 minutes. If you're free, we'd love to keep going. We have quite a lot of questions. If that's okay, can we? Terima kasih. Bye. So the next 2 questions from people you know well, Professor Budi Reso at ANU, and then after Pak Budi, it will be your UI colleague, Dr. Pandu Riono. So, Bud, can I go to you first, and then I go to Dr. Pandu?
Thank you, Hal, and thank you, Pak Bambang, for a very informative presentation. As Chris and other, I do learn a lot. My first question, this is representing friends from university outside Java. So many of them, those academic, are eager to involve in this fight to handle COVID. However, as you can see from your slide, mostly the activity concentrated in LIPI, BPPT, UI, Erlangga, and so on. So there's one, is there a strategy within the Ministry of Research and Technology to actually being able to embrace the eagerness of regional university to participate? Yes, there is an issue of quality, but also they could help in some specific issues. So that's the first question. The second question is that looking at all the technology that you presented, there isn't much indication that Indonesia has been collaborate with international organization or with other countries in terms of finding either vaccine or either treatment. Is this because of a patent issue, claim on patent, or what is it? So that the opportunity to have collaboration among with other countries, and particularly in this case with Australia, doesn't seem to be shown in what you present. And the third question, I'm sorry, Pak Bambang, this is back to the triple helix. Also, again, on those material that you presented, I do not see biopharma, for example, is actually in part of the presentation. Is this, do they do not do anything? Is there is no collaboration between VPT and biopharma or between the, so our private sector on medical supply is actually quite big, isn't it? Biopharma has a university. So what happened between this private and government entity in terms of collaborating, solving the problem of public health that we have? Thank you.
Should I respond, Hal, directly?
I was going to say, Pat Bambang, it's normally the case that your best friends ask you the most challenging questions. Very, very interesting questions. Thanks, Bud.
Okay. Let me answer maybe from the end. I think, yeah, if I can share my presentation on triple helix synergy, please share the triple helix at page 6, yeah, at the beginning. 6, yeah, stop, no, 6, yeah. Pak Budi, yeah, maybe it's too small, yeah, not because we are old already, so it's hard to see the small things, but Bio Farma is there, maybe under the sign of Kementerian BUMN, yeah. So Bio Farma is there, and I can tell you, Bio Farma is very active and very instrumental in this triple helix synergy. Number one, they now the producer or the industry of PCR test kit. So it's not the RT-PCR machine, but this is PCR test kit that will be used for every sample test. So PCR test kit now produced by Bio Farma. Second one, the plasma convalescent now produced by Bio Farma after the research done by Eijkman and universities. And third, Bio Farma is, of course, the main important part of our vaccine development. When I mentioned that we collaborate with China, actually Bio Farma did the collaboration, doing the collaboration. They're working with Sinovac, one of the pharmaceutical in China, that already has their seed vaccine of COVID-19 doing the so-called the second stage of clinical trial. So Bio Farma is very instrumental, even if I have to rate the importance or the participation of the private sector, including SOE, Bio Farma is at the top because it's their core business, not only in vaccine, but also in the so-called medical equipment like the PCR test kit. That's number one. Regarding the role of the local universities, and we can also see here, of course, we are talking about the research and innovation that has to be done, unfortunately, in very short period of time. We are talking about only 3 months. Some of the products that I already presented only produced by 3 months. And of course, the ones that are ready is the ones that, you know, submit their proposal to us. And we agree to support their proposal. However, we do not only support so-called public universities, the ones that you know very well, but we also include, for example, Universitas Al-Azhar, the one that produced purifying respirator, Telkom University, that produced the ultraviolet for the disinfectant, and I forgot to mention Universitas Mataram, UNRAM, which is in Lombok, in Kota Mataram, is part of the team that developed the rapid test together with BPPT. So BPPT, Gajah Mada, Erlangga, and Universitas Mataram involved in that, and even the main producer is a company from Mataram, which is private sector, PT Hepatica Mataram. And one thing that I forgot about this triple helix is the synergy itself. This is for the very first time maybe in our history, there is a very strong and close synergy among stakeholders working in research and innovation against COVID-19. Previously, it's hard to create the collaboration, but during this pandemic, collaboration can be done easily, and synergy is quite strong. So not even a single agency, a single university or single agency can claim, or this is our own product, and we are the only one that innovate the product. They will say, oh yeah, for example, BPPT, I work with Universitas Pajajaran, I work with ITB, I work with UI. So I think this is a good start, you know. And of course, this is not the exhaustive list of the parties involved. We now have the second stage of our support to research COVID-19, including the local universities. And how can local universities, especially outside Java, can participate? Now we are trying to build our own independence of so far, we depend on 90% import of medical equipment and 95% import of medicine, especially the substance of the medicine, chemical substance of the medicine, because we don't have the industry. Instead of trying to compete with big pharmaceutical company that based on the chemical stuff, we are trying to develop the ones that develop from our own biodiversity, from our own herbs. And I believe different universities now, they have their specialties in their herbs. And we already opened the possibility for them to be involved in COVID-19 through the research and kind of clinical trial of their extraction of biodiversity or extraction of their herbs. And now we have, for the second stage, we now have participants from Gorontalo, you know, also from Makassar, as well as from Sumatra, because now we are trying to explore as much as possible our biodiversity for COVID-19. Last but not least, about international collaboration. Yes, we are open for international collaboration, especially on vaccine and medicine. And for medicine, for example, we are doing clinical trial for any type of medicine that has been considered quite useful in other countries for COVID-19. That's why we are doing clinical trial of Avigan and others, chloroquine and others. And of course, we have close collaboration with WHO, but I think in this stage, the more important thing is collaboration in vaccine. And Bio Farma not only, you know, involved in B2B relation with a company from China, they are also involved with so-called CEPI, which is kind of consortium of companies in Europe and US that trying to produce vaccine. So we are involved, but of course, given a limited period of time, and given, of course, the urgent need, sometimes we do it parallel. I mean, we do it our own way. At the same time, we are trying to collaborate with international side. And for vaccine, for example, for China, the good thing about vaccine from China is not just they already in the clinical trial stage 2 or stage 3, but more importantly, they already emphasized to us, because of this pandemic, we will not apply the patent or the property right for their vaccine. So basically, it will be just B2B relation without, right or license of the vaccine itself to Bio Farma. And I think it will be for the benefit of the Indonesians.
Thanks, Pak. There are three very big issues and topics. Thank you. Let me now invite Dr. Pandu Riono, your former colleague from UI, Pandu, who of course has spoken at our in this webinar series. So Dr. Pandu, and then after Dr. Pandu, I'd like to invite Anis Fabrina from KSI. So Dr. Pandu, silakan.
Terima kasih, Pak Hal. Selamat siang, Pak Bambang.
Yeah.
I just wonder the role of your institutions, because in the past month we have a lot of claim or new data, new research claim that they have already found in new medicines, and they have new tools for prevention and kill antivirus, something like from the research from Ministry of Agriculture. because it seemed that all the research institutions not yet coordinate. It should be in the long should be in the future should be all the research from any research from any institution should be coordinated by your institutions and discussed internally before they publish to the public, because all the information is make confused for the public itself. And that's the instruction from President number 4, 2019 about the preparations of pandemic mentioned that Ministry of Research should should coordinate among the research institutions and working together. And the important one is the second about this pandemic will be take longer than more than 2 years might be, and the problem to respond to stop the increasing cases should be have a good strong surveillance. And in this instruction from president is the second item is to your institution should be forced to have some collaborations among research and surveillance among all laboratory. And this is important because in the future, testing and contact tracing and isolation is the only way we can detect and to stop the transmissions. It means that this is a big opportunity for your institution to strengthening their surveillance and collaborations among the laboratory for detections for COVID. And the third is because not our problem is not COVID. Our problem is the impact of COVID to the public health services. All public health services, all basic public health service is disrupted by this pandemic. Immunizations for the kid, there's already stopped or delay. It means that in the future, our generation is lost or miss the opportunity to get the infections. It is also the opportunity to research, to make safety to all the public health services, in the primary health services, to get health services. And because they're afraid, they don't have any potential to have some protection to maintaining the services, they're afraid to do. And also the people also afraid to come to the health services point of care because this kind of thing. It means that many research to do in the still primitive way. I mean, the still how to have some protections for the people in the doctor and a nurse in the Christmas, because they will go to the people to have some provide services. It means that so many, not only COVID, not only the high-tech COVID, but also the basic and operation research is more important currently. And because this pandemic will be more than 2 years, maybe 3 years, or maybe 4 years, we don't know, because we don't have any solutions in the near future. Thank you, Pak Bambang.
Okay. Makasih Pak Pandu for your question. I know your first question refers to things that have been quite viral in last couple of days and last couple of weeks. Most notably the one from Erlangga that claims that they already have the medicines for COVID-19, and the other one is from the agriculture, research institution under the Ministry of Agriculture. So first of all, of course, when you look at our agency, which is National Research and Innovation Agency, according to the law number 11/2019, the role is to integrate the activities of research, development, assessment, and also application from all institutions in Indonesia, both in ministries as well as on the institute like LIPI and BPPT. We are moving toward that kind of integration, but as you know very well, the bureaucracy in Indonesia is not easy. So to make sure all the Litbang or all the R&D department of ministries joining BRIN, joining our institution and RIA, actually I have to do it quite gradually because there are quite strong resistance from some ministries, including Ministry of Agriculture. So that's why the research activity is not really connected to the consortium that we have established at the beginning of this pandemic. And for Erlangga, actually, they're already involved. Some of their researchers already an active participants of our consortium. They have been active in, for example, whole genome sequencing. They have been active also in also for the supplement, and also quite involved in vaccine development. However, there are some individuals in Erlangga University that trying to work by themselves, and at the end, I don't know, they work with whom, and they come up with a claim, and unfortunately, the rectors just announce it like that, without checking whether the medicine needs to have clinical trial that is approved by BPOM or by our FDA. So again, I mean, of course, in my position, I believe when it comes to the claim or explanation to the public, I think either Ministry of Health or BPOM needs to be in front and tell the public right away, okay, this is not the medicine, this is not the vaccine, this is just like supplement. And supplement, even supplement, you cannot say, this is already supplement proven for COVID-19. You can say supplement may be good for your health, good for your immune system, or at least, as they mentioned, this is good for corona. But corona doesn't mean it is COVID-19 because there are different types of coronavirus, and one of them, the newest one, and actually the unknown one is the COVID-19. So I think BPOM should be more aggressive in making the explanation so people will not be hesitant, to at least people will not rush, to believe that the medicine is there. And what I'm very, very afraid, and Pak Pandu is expert in public health, if they are very sure that the medicine is there, they just consume the medicine in many ways and then just go to the, for example, go to the public places, go to the crowds without wearing masks and without others, and at the end, they can get infected. So I think BPOM needs to be more aggressive, or at least National Task Force should also give clarification if BPOM feels that this is not their portion. But your point is very well noted. Once we have been able to integrate it, all the R&D activities under one roof, under our institution in BRIN, then hopefully things that happened in the last couple of weeks will not happen in the future, because we always follow all the regulation related to the permit, especially the permit or license related to the human being, because we are not talking about the engine, we are not talking about medicine, and medicine of course has direct impact to the health of the people. And then regarding...
excuse me, Maaf sekali, Pak Bambang. Maaf mengganggu, I'm just worried, I think we're almost running out of time and we have so many more questions to go through. Could I perhaps just intervene and just invite a couple more quick questions, because I know your time is very short.
Okay, no problem.
And then the remaining questions we will pass on to you, because there's quite a lot. The problem is you've been so stimulating. A lot of people have started to ask questions.
Okay.
But I would like to invite just two more questions from the participants who've been waiting. That's first is Anissa from KFO. But can you ask, and then please keep it brief. And then I want to go to Erlina. Likewise, if you could please keep it brief. So we'll have the two questions and then we'll go back to Pak Bambang.
Yeah.
So first, Anissa, please.
Thank you, Professor Hill. Pak Bambang, a quick question from my end. The orchestration of synergy for innovation responding to COVID that you've elaborated has been really encouraging. May I probe further on policies under Ristek BRIN that you are planning or on the way to help institutionalize that kind of synergy or further enable further collaboration, for example? Specifically, to expand beyond the current scope of research through to research for COVID response policies and further even to strategic sectors to help build Indonesia's knowledge economy. That is basically my question. Thank you.
Terima kasih banyak, Mbak Anissa. Mbak Erlina, would you like to speak?
Thank you, Pak Hal. Thank you, Pak Bambang, for the interesting presentation. My question is related with this. It seems to me that the social condition is also very dynamic, Pak, and we can see still and family hospitalized because of COVID-19, they have rejected from being hospitalized. And also we can see still that the corpse in hospital also being picked up by the families, and then it's very risk in society. And it will then increase the infection in society, and it's really worrying us, yeah. So how will the government, do you think, will respond to this situation? Thank you.
So back to you, Pak Bambang. Actually, mohon maaf sekali lagi. There's one person on the list of questions I just cannot refuse, and that's our dear friend and colleague, Professor Mei-Ling Wee. Mei-Ling, are you able to talk? Otherwise, I can read your question out, but please, could you keep it brief? I'm not sure whether Mei-Ling is connecting or not. Pak Bambang, I will just read Mei-Ling's question out, if that's okay. As I say, we have to have her in the program as a dear friend. So Mei-Ling asks, can I please return? She also says, thank you for a very informative presentation. Then she asks, can I please return to the data? How transparent or how can the public get access to the data? Based on your explanation, do you happen to know what the cases represent? Do the numbers represent after it is known the person is positive, so likely after a few days they've been tested? What is the possibility of accessing data? So, mohon maaf sekali, Pak Bambang, I know we're just about out of time, but if you'd like to just pick up anything in those three other questions, and then what we will do with the remaining questions is we will pass them on to you and your office for your consideration separately. Terima kasih.
Thank you, Hal. Let me continue answer Pak Pandu question regarding surveillance, especially for lab networks. I believe we have been very active. As I mentioned at the beginning, it is done only by the Litbangkes or Ministry of Health R&D agency. But at the end, they are trying to involve everybody, and Eijkman Institute at least has been very active together with LIPI, not only doing the specimen test, but more importantly, they have been involved in, for example, providing VTM, which is important for the operation of the lab. Plus, they also provide support for some red zone area, the ones that have high infected people. Plus, as I mentioned also, we do the training for additional lab personnel, especially coming from the students. So that's what we are doing, because at the end, the coordination done by National Task Force and led by the Litbangkes or the Ministry of Health R&D lab. And then regarding the impact of COVID, I agree that now everybody thinks about COVID as if there is no other disease, still occurring in Indonesia. Especially we still have problem with tuberculosis, we still have dengue fever that actually has fatalities rate higher than the COVID-19 itself. So I guess why everybody jumps into COVID-19, simply because the economic impact of COVID-19 is so big, you know, as you can see from our GDP growth and, of course, the real economic activities. So I think we still keep doing the research related to dengue fever, to tuberculosis, and in fact, Eijkman, for example, although now they are working on vaccine for COVID-19, they still do the research on vaccine or other treatments of tropical disease, including dengue fever and tuberculosis. Plus, of course, we need to promote more, I think, telemedicine in order to, you know, to encourage people to consult with the doctors if they have problems with their physical condition. But at the same time, we are not encouraging them to go to hospital just like that, because then they will be exposed to the possible COVID-19. Or, of course, some regions, some areas already make differentiation between hospitals that will take care of COVID-19 and hospitals that will not deal with the COVID-19, because COVID-19 will be concentrated in some hospitals and other hospitals should be dedicated for disease other than COVID-19. I think that's another strategy that now being carried out by some regions. Untuk Mbak Anissa, yeah, how to institutionalize synergy? I think BRIN is the one that will institutionalize the synergy. And the synergy during the COVID-19 with the consortium, I think will be a good role model, will be a good example on how we can apply the similar synergy into other topics. And of course, we still doing research and innovation related to some critical topics, like, for example, the energy issues, including renewable energy. And then we are still working quite closely for defense research, especially the development of drone, you know, as a military equipment, and to reduce the import substitution of salt. We are also working on the research to develop the integrated salt industry that has been done by BPPT. And of course, our policy is to promote more innovation. I mean, we will support the research, but of course, we do the research not just by creating, you know, publication or a good report, but more importantly, how can we downstream the research itself? And it doesn't have to be done by the same individual. If you are good in, let's say, research in physics or biology, it doesn't mean that you have to work only by yourself trying to do the downstream of your research output in physics. Instead, other peoples, other institutions, other universities, other experts might be involved. So at the end, there will be a good network from the upstream up to the downstream, from the basic research up to the innovation. Untuk Mbak Erlina, my response to the social condition, I think the government still needs to do public education. And I remember one interesting discussion in a cabinet meeting, you know, one of minister tells president, we need to use so-called definition that is basically easily understood by common people. For example, let me give you in bahasa. Usually, we tell everybody COVID-19 is dangerous because you can infect other people through your droplet, and droplet becomes like a common word. The question, how many people in Indonesia understand about droplet? And then this specific minister tells president, instead of using droplet all the time that people might not understand or they think is something that unimaginable, why don't we use istilah muncrat? Ya, kapanpun kamu muncrat, itu artinya kamu menyebarkan COVID. That's the kind of language that needs to be used. So it means communication, public education needs to be strengthened. Because if you remember, one of survey, if I'm not mistaken, identifies more than 50%, I think 30% doesn't really believe COVID is there. COVID-19 is there. 50% saying that they are not very sure whether COVID is there. So some of them absolutely sure there is no COVID. Some others feel that they are not sure whether COVID is there. So I think this is scaring statistics, worrying statistics, given the fact that the danger of COVID is because of they spread easily, not because of something, but because they spread easily. And that's why we still have high cases, not only because of the higher testing that we have done, which is good, but also because lack of discipline from the people, including the cases that you mentioned. So I believe public education needs to be strengthened, but with so-called down-to-earth definition, down-to-earth communication. Last but not least, for my senior, Ibu Meling, about the transparency, unfortunately, I cannot answer the question because it's beyond my authority. Its authority is between, I would say, between Ministry of Health and a national task force. I hope there will be a good coordination among them, so people will not be, will not be confused by different version of data. Although President in many cabinet meetings always emphasize the one data policy. Everything from the government has to be single, including the data. So there is no data versi Ministry A, data versi from Ministry B. There's only one data, government data. And that's the one that you watch every day, and delivered by Director General in Ministry of Health. I think how that my best effort trying to answer, I think, quite a tough question. Thank you.
Well, Pak Bambang, terima kasih banyak. Your best effort is a wonderful effort. This has been a really informative presentation. I realized the problem we had, Pak Bambang, was we should have asked for 3 hours of your time, not 1.5 hours. But we know that's not possible. You're a very busy man. But I just want to say thank you so much for being so comprehensive, speaking with such great authority, and informing us about a lot of complex issues. So, terima kasih banyak, Pak. And I guess we feel a sense of, cautious optimism. The fact that the Indonesian cabinet has professionals like yourself in it and working for the public good. So, terima kasih banyak from all of us. And let me now hand over back to my colleague Pak Acho. And just to say also, I think the Indonesia project is running a most wonderful seminar series in which Pak Acho and Pak Nuk and Pak Dodi have been the key people. So back to you, Pak Acho, and thanks again, Pak Bambang.
Yeah, thank you, Hal.
Thank you so much, Pak Hal. On behalf of Indonesia project, I would like to thank again Pak Menteri, Pak Bambang Brodjonegoro, and also, of course, Professor Hal Hill. Thank you so much for chairing the session. Thank you for all the attendance, and my apologies to those whose questions we did not attend given time, but we make sure to send your questions and feedbacks to the Ministry's office. And next week, I think we will have another webinar on how religious-based communities deal with COVID-19 in Indonesia and other countries in the world, with speakers Nafa Nurania and Eva Nisa. So stay tuned, and we'll see you again next week. Thank you so much, and I think we will close this session. So once again, Pak Bambang, thank you so much, and please stay healthy.
Okay. Thank you, Pak Cok. Ya, thank you semuanya. Ya.
Makasih, Pak.
Terima kasih banyak, Pak Bambang.
Ya, makasih.
Terima kasih, Pak Bambang.
Terima kasih, Pak.
Kami end ya semuanya.
Ya.